time. Usamachiza is here. Usamachiza, good morning and thank you for joining us.
Good morning. Good morning to you, Sis Lhoza. Good morning to your listeners. Thank you for having me.
Siyabulela Usamachiza ke nguye Usamachiza olapha eAmalinda eAmaway Lwanda's Pharmacy uyaphaya ke uncedwa nguye ubuqu. Kubona ngongena kweza pharmacy zabantu badala ufike uthi gqela xhego lini nenhloko emhlophe linxiba iduster coat yalo qoma xa uncedwe lilo ndikubona phasa amachiza okanye ndingeba
coat guys lab coat
like kuthi ke iduster coat siyeke please allow us sibe sithi inina so lab coat so uzawuqonqa
can you mean nje
xa ne chance
yeah
xa nethuba phuma kumyasi babunxibe ke okay the lab coat
second week
okay no it's fine qhuba ndikujongile so uzabunxibile ke inhloko emhlophe umuntu aqonda ba xa kukho ezo pharmacist assistants uqonda athi umuntu bengicela utamkhulu Lwanda uthi gqeke ngokusamachiza
inkothovu
so prescribe ungajonganga nojonga uthi makafumana into ethile lawo unento ethile
betha ngebluetooth
Machiza make size kule sithetha ngayo namhlanje phulaphula kuleli xesha loba nasibona ba abantu as much as basiku August kodwa abantu khona ukukhohlela ikhona yonke into nasiyazi neyo nayo nayenzekayo namhlanje sifuna ke sijonge into bana ingabe ukukhohlela oku is it a symptom okanye isigulo on its own, is it a disease?
Yeah so very important just to ucacisa umahluko.
Sure.
I-symptom zimpawu ndiyazi njani ukuba ndiyagula. What are the symptoms of this disease condition? Impawu, so we have it was these signs and symptoms ngokwesilungu.
Okay.
I-disease condition is the actual sigulo, yebo. Ukhona ke a body that sits and decides these things. Umzekelo, for years it was believed that depression is not a disease condition. There's umzekelo including mental health.
Yeah.
So medical aids did not want to cover amayeza kuthiwa eliyeza lizawunyanga depression. No, but depression is not recognized as a disease condition. Therefore, single medical aid 1, 2, 3 asisiwabhatalela lamayeza.
Okay.
Kude ke kubekho abantu who will argue with research and that sort of thing, no professor nobani, but no, lento lena is actually a disease condition ngenxa yezizathu nezizathu.
Sure.
Ayibalekanga kuwe mhlawumbe wena ungumphulaphula ngoba xa kutheni abantu xa kuzawuthiwa into yisisigulo xa kutheni xa kuthiwa zimpawu.
Okay.
But it's just for you, what I'm communicating namhlanje is that zikhona izinto that are registered ayo opinion kaLwanda lena. Zikhona izinto on a particular document ziyaziwa, health recognizes them as zizigulo is zikhona izinto that are recognized as symptoms of izigulo.
Sure.
Zawutenza umzekelo ngento ye-nausea, vomiting and diarrhea nasisiloza. Umuntu angakwazi uba ahambise because uyagula, igula into ethile, and then as a symptom cholera umzekelo then lo muntu uzawuhambisa.
Sure.
As a symptom of other tummy infection so into enjalo lesiyithethayo. Ungaba nenhloko because you have a migraine, it's a migraine headache.
Sure.
Unenhloko because tension, unenhloko because you have anxiety, unenhloko, for many different reasons. You can have a headache because you had COVID. That's umzekelo.
Yeah.
So there's izinto is, but okay, now
a symptom.
It's a symptom, yes. Can we treat symptoms, and do we treat symptoms? Yes, we do treat symptoms. Umzekelo, xana sithi umuntu une-flu, isikakhulu during COVID abantu bayibonile laa nto sathi asikwazi uyinyanga yona i-flu okanye i-COVID, but we can treat the symptoms.
Ukuthomalalisa kwenzela ingakhulile into nazi into esizibonayo masidilishane nazo.
Uyafika ngoku uyakhalaza uba ndinentloko, uyafika uyakhalaza uthi ndiyakhohlela, umqala wam uthe, amehlo wam athe, iimpumlo ziyarhawuza, into. We can treat these things. These are the symptoms, and then we just wait for the body to take care of the underlying infection.
Sure. Landithi uvantoni, landithi uvantoni uzawutsho wena njengosomachiza ndikunceda ntoni namhlanje. Ndithi mna ndiva impumlo zam zimfixene okanye mhlawumbi ndiziyabaleka, ndiva ungathi noqhwethe emqaleni, intloko okanye umzimba wam ubuhlungu. Those are the symptoms endichazelayo zona wena ungusomachiza.
100%.
Then when ibe ngobonayo into yobana okay, ayibuhlunganga indawo ethile, uyabona,
So
ufuna utshekisha ke ngoku.
kule ndawo sithetha ngazo Lhoza kwenzeke imistake yokubana kaloku xa nithanda Lwanda nina you treat the symptoms. Iqonda? Because ngoku utshoyo kum Lwanda sithi hayi ayikho i-treatment ye-flu, ndiyafika kuwe phaa ekhemesti ndixela uba ndine-flu and you give me medication, you know?
For flu.
Yes.
Sure.
Today you are on KNR uzothetha into yokubana let us not treat the cough, let us treat the underlying symptoms. So guys, sisa eyiphi komkhulu? Nizawusa komkhulu lena sinixelela yona at the time, right? So there is no blanket approach. Yabo, so usawufuna ukuyinqaya lento yesigulo. You know, you must just consult, you must ask at any given time. But again, we are here this morning and sifuna into yokubana you know, what's the word I'm looking for is discern, you know, discernment, for you to be able to decide to make an informed decision. But no, when I have a persistent cough for more than 2 to 3 weeks, Lwanda said that it is a problem.
Masijonge ngoba ubangaba ibilikhohlo nje ke belifanele baseliphelile mhlawumbi kwintsuku ezintathu uya kwezine.
Yes.
Sure. Okay.
So, you know, there's this thing now where people come to the pharmacy and chincha my ears. I tried that one. I think it doesn't work because it's too sweet. I want that one because it's kaka. You know, I want that one.
The medication.
But now we were on week 2. So immediately for me as a pharmacist, I say to that patient, no, you are going to finish all your money changing the different cough medicines.
Okay.
A cough is a signal that something is wrong, right? It's saying, hey, watch there, you know, there could be something. Then we start asking questions. Is it dry? Is the phlegm? What color is the phlegm? If the phlegm has a greenish to yellowish color, then we know that there's a bacterial infection there.
Okay.
You know, is the cough persistent where, you know, once you start coughing, I now cough for like 5 minutes and I need some water, that kind of thing, you know. For many people, I was able to pick up that some people are on high blood pressure medication, belonging to the group called ACE inhibitor. So as a side effect of that medication, this makes people cough. Now I'm meeting someone for a year or 6 months. They've been taking something for this cough, you know, whereas all they needed to do was just stop taking that blood pressure medication that is causing the cough.
Oh.
Yeah. So sometimes it's something that's just that simple. Sometimes it is TB, you know, because the cough is accompanied with night sweats. It's accompanied with, you know, blood now in the phlegm or the sputum.
Okay.
There's weight loss. There's loss of appetite. Then now we can say, we think this is TB.
Okay.
We can give you all the cough mixtures. These cheap ones are not working. Guys, it's not the price, right? There's something else here. There's something else that we need to look forward to. That we need to look for, sorry. The most important, I think, for today is Lendo, asthma. You know, there's a big denial around asthma when Lhoza, and now that we are in this season, the asthma yabantu picks up, you know, and abantu babana, it's at a peak, you know.
Okay.
And abantu have this thing, it's winter, therefore I have flu. No, it's winter and your asthma gets worse.
Okay.
And you are not treating it. So you can see that blue inhaler that is for relief, you know, so that you can breathe. You are using it more now. You find yourself going to the pharmacy because that one is over the counter.
Yeah. Yeah.
Umdana awako around winter gets a lot of chest infections. You are always taking your child to the doctor during winter, maybe 2 or 3 times.
Okay.
Your child has asthma. and you are not treating it. So now the child is more prone to get these chest infections.
Oh, ish. Siyafundiswa mphulaphula uyaqala uba nathi emqubeni is 26 minutes after 8. Sixoxa naye Somachiza Lwanda kaMkhatshana. Sizama ucacisa le nto idibene nokhohlelo. Bangathi kuyaprolonga. Khayisabele man. Ifanele ba ikhona into engaphaya kwale ngoba kumzimba yena nto okoyaqala le feature kukufundisa into bana umzimba wakho uyakunika isignal uyathetha nawo ba nansi into ti khawuleza uyoyijonga siyeke ukuzidiagnose masihambe siyova kubantu abaqeqeshelwe ukuthi uba kwathini kwaye asiwayaleza amayeza ndithi Somachiza
injalo
asinikeli ngesigulo bamamela wethu sosungicelela nomrapho apho namntu sowusiye ekliniki sosuchaza uyakhohlela nokukhohlela efoldeni yalamntu kubhalwa uyakhohlela kanti ayilo lakhe lokhohlela uzalinike next door so azenziwa ke ezo zinto ngoba uzazibona
because it goes to your medical history.
Yes, wena mntu uyileyo
now okutreatayo uthi hey hayi man I noticed that you are also suffering from and now is using the incorrect medical history to come to a conclusion yoba inobunantoni nakanene and then we're saying hey abagqirha bayazi lento bayenza hey abanesi bayazi kanti sibanika information erongo
uba unikelwe isigulo ndicinga uba sicacisele ndawo unless mhlawumbi nento ofuna uyibethelela kwento idibene nokukhohlela being a disease or a symptom. Somachiza?
Yeah, I think the emphasis today is on please query asthma. Please
and sinus siyayithanda laa nto yomfixana uthini sisibiqoma awethu yi-flu but must but there's uyawuba chronic.
So I call them the triplets,
Okay.
Sinusitis, eczema, asthma. They come in 3. If they are not there in 3, best believe 2 of them are there. When there's eczema, best believe that there must be asthma there or there must be sinusitis there. When there's sinusitis, you must believe that you will also find asthma or you will also find eczema. Where there is eczema, so yes, something to look at. Guys, I don't want to admit this asthma diagnosis because it will mean that now I use a pump and using a pump somehow means that I am weak. There's a stigma around the pumps and that I'm going to be dependent on these pumps.
Yeah.
Why do we have pumps? We have pumps because we have something called targeted drug delivery. So you must imagine a bull's eye when someone is throwing a dart. So that's what we mean by a targeted drug delivery. Yeah.
Okay.
So if you are saying I have an eye infection, we must be able to give you something that goes directly to the eye.
Yeah.
If you are saying I have a rash on the skin, surely we must be able to give you something that goes directly on the skin. So this is what we call targeted drug delivery. In pharmacy, we call these drug delivery systems.
Sure.
So you can take an oral medication, right? So you take it, it goes to your stomach, it goes to your small intestine, it is absorbed, it goes to your liver. From the liver, it then goes into the bloodstream and goes where it needs to go. In this process, this medication can create its side effects because now it is going all over. But we can target the delivery, meaning we can put that same medication, that exact same medication, we grind it up, we put it in a pump, we put pressure in that pump, and we say to this person, just push this thing and inhale so that it goes directly to the lungs where the issue is, and the medicine can then act without going. So now you are saying, no, but I prefer, your preference is the one that is causing you issues. Now you're taking the medication orally and it is also affecting your heart. You're taking the medication orally and it's also affecting your bones and it's causing an asthma and it's causing, ulcer and it's affecting other things. So Lendo pump is us trying to make your life easier. We are not making your life asizama ukusokolisa. You know, we are trying to make the side effects less.
Ngumuntu wenqawa kaloku wena.
Yayibona?
Sezazinto sizibeka lehle sibeka ngayo.
Yeah, and
ibe ngathi
you must understand that you are already sick. The pump is not going to make you more sick. The pump is supposed to treat you.
Sure.
So there's no point fearing the HIV test. The test is not going to make you positive. It's just going to tell you whether or not you are positive or negative. Same with the pregnancy test. Same with any other test.
So njengoba ungafuna utesta ayithi awunayo okanye you need to also know your status.
All it is just telling you. So not using the asthma pump is not going to mean you don't have asthma, and it's not going to mean that it's making your asthma any better.
Sure.
It's just going to get worse with time.
Okay. So Maxiz, let's leave it there for today, right?
Yes.
Yeah. Siqobile mphulaphula bangabone topic ongasingaza singakhe sicubungule sihlamahlongwane apha ke enkqubeni ungenza ngolo hlobo ke ungatext uSomachiza #asilwanda okanye ke uye pha kwi-pharmacy amalinda main road amaway kulapho uzamfumana khona okanye kwi-inbox emna okanye bhalela isikhululo info@keithgeziradio.com kwenze into ukuthi jonga khani internet topic ethile sizokwazi ke uba siyibangule uzokwazi ke ufundiseka nawe mphulaphula. So Maxiza, thank you so much for your time.
Thank you to your listeners, Lhoza. Thanks for having me. Thank you.
All right, masimkhuphe ke uSomachiza qala masenze ngohlobo.